Hi there, this is Dr. Kukreja A. Kalani. I am a practicing homeopath. I am practicing homeopathy since last 25 years at Powai, that's in Mumbai. And today I'll be speaking in depth about what are the various skin infections, and along with that, I'll be also speaking about the allergies, the chronic skin allergies, and what is the role of homeopathy in treating this chronic skin problems. Because many a times we have seen that when you leave them unattended, when the immunity backup is not there, the problem goes on increasing because local applications do not aim at curing the internal disorder. So, what is the role of homeopathy in treating the chronic skin disorders? We'll be also talking about it, and what and how does it help. So that's very important. So let's speak about the skin infections first. So skin infections and skin allergies, the main difference between them lies in their causes and mechanisms. So what are the causes? So what are the causes for the same? The skin infections are typically caused by bacteria, viruses, fungi, or parasites invading the skin, leading to inflammation and other symptoms. Common examples include bacterial infections like cellulitis or impetigo, viral infections like herpes simplex, chickenpox, and fungal infections like athlete foot, and parasitic infections like scabies or lice. Whereas if we have to describe the skin allergies, they are caused by an immune response to specific allergens. When the skin comes in contact with an allergen, your immune system reacts, leading to itchiness, redness, rash, and swelling. So, what are the symptoms? The skin infections often present with symptoms such as redness, swelling, warmth, pain, pus filled lesions, or blisters. Skin allergies typically manifest as itching, redness, swelling, or a rash at the site of contact with the allergen. The reaction may occur immediately upon contact. And what's the treatment here? For both the skin infection and the skin allergies, skin infections are usually treated with medication depending on the causative agents, while as the allergies are managed by identifying and avoiding the trigger allergen. In summary, while both skin infections and skin allergies can cause skin related symptoms, they differ in their underlying causes, mechanism, and symptoms. So, proper diagnosis is very, very important. So, let's discuss in detail about the both. The skin allergies, also known as allergic contact dermatitis, occurs when the skin comes in contact with a substance that triggers an immune response. This leads to itching, redness, swelling, or a rash at the site of contact. And the common allergens which are known are the fabrics, the cosmetics, the fragrance, the metal allergies, the plants like the poison ivy, and the topical medications. So, avoiding and identifying the trigger is the key to managing the skin allergies. There are several types of skin allergies. First is the allergic contact dermatitis, second is the irritant contact dermatitis, third is atopic dermatitis. So here in atopic dermatitis, it's a chronic inflammatory skin condition causing dry, itchy patches which flare up due to various triggers including allergens. And what is urticaria? So these are the raised itchy welts on the skin that develop in response to stress or allergens or stress, any other triggers. Next is the angioedema, that is the swelling of the deeper layers of the skin around the eyes, lips. And what is the photoallergic dermatitis? It is the allergy which is triggered by exposure to the sunlight. Then there are drug allergies, then we have food allergies. Each type of skin allergies has its own specific triggers. So that's very important to identify the triggers. Then we come to the skin infection. So your skin is the largest organ of your body. Its function is to protect your body from infection, but sometimes it gets infected itself. So there's a wide variety of germs which can cause the infection, and the symptoms can vary in presentation from mild to serious. So the following are the four different types of skin infections. First is the bacterial, second is viral, third is fungal, and the fourth is parasitic. So first is the bacterial. The skin provides a good barrier against the bacterial infections. So when you come in contact with the bacteria, or they are normally unable to establish any infection. When bacterial skin infections do occur, they can range in size from a tiny spot, or they can also cover the entire body surface. So these are the bacterial skin infection, often begin as small red bumps, then they slowly increase in size. Different types of bacterial skin infection include cellulitis, impetigo, boils, leprosy. So what are the viral skin infections? This can be reaction to inside of your body, or they can be an actual infection of your skin. They range from an entirely harmless to a quite a serious condition. They can be contagious. Others you can touch without catching. Different types of viral infections include shingles, chickenpox, molluscum contagiosum, warts, measles, hand, foot, and mouth disease. Next is the fungal, which is caused by the fungus. There are millions different species of fungi. They live in dirt, plants, or household surfaces. Sometimes they can lead to skin problems such as rashes, bumps. Since fungi thrive in, particularly warm and moist environment, fungal infections can often develop in sweaty or damp areas that don't get much airflow. So the most prone areas include feet, groin, folds of skin. Only these infections appear as a scaly rash or a discoloration of the skin which can turn very itchy. Although the infection can be pretty, annoying and uncomfortable, but they are not serious, meaning the prognosis is good. The fungal skin infections are often spread through direct contact. So, what are the common skin infections which are there? What are the most common ones? It's a athlete's foot yeast infection, ringworm, nail fungus, oral thrush, and diaper rash. Next is the parasitic, the fourth one, the parasitic skin infection. It usually, small insects or worms that burrow into the skin to live there, to lay their eggs. So, as the skin is constantly exposed to the environment, it represents a common portal of entry for different parasites. Infestations with parasites can cause systemic diseases in humans, but often result in cutaneous lesions which are on a rise in the during our clinical practice. We see a lot of these skin infections because of parasites, because of the travel and immigration. Parasitic skin infection include lice, bedbugs, scabies, cutaneous larvae, migrants. Now we come to the most important part of this podcast. It is what is the role of homeopathy, how homeopathy helps in treatment of skin ailments. So let's talk about homeopathy in brief. It is based on the principle of like cures like. The symptoms are the body's way of taking action to overcome an illness. It's a healing response, is automatic in living organisms. So it is termed as the vital response. The application of the correct homeopathic medicine increases the body's ability to respond to an illness and so makes the body's own healing more rapid and effective. In homeopathy, we use the minimum dose, so we employ minimum dose. So, and upon the understanding that the stimulus of the medicine works from within and is not imposed from outside. Only enough is administered to initiate the healing process, which then carries on or driven by its internal healing mission. The use of minimum dose has the advantage that it does not produce any side effects, so often caused by conventional mode of treatments. The conventional medicines suppress the symptoms by masking it. That is why you often have to stay on these medicines for long time, and your symptoms return when you are when you stop or taper down these modern drugs. Homeopaths do not suppress symptoms. Homeopathic treatment works with your body's own healing powers to bring about health and well-being. Patients are treated as individuals, not as a collection of disease symptoms or labels. Homeopathy treats all your symptoms at all levels of your being: spiritual, emotional, mental, and physical. So, homeopathy offers holistic approach to health and healing. So next we talk about what is a constitutional prescription in homeopathy. This refers to the selection and administration of homeopathic medicine over a period of time for treatment related to inherent disorders, those caused by inherent predisposition to a disease. The constitutional remedy covers the genetic makeup, the physical and mind symptoms, their thermal state, desires and aversions of mind and body. So, how does a constitutional prescription help? So, homeopathic treatment acts as an immunoregulator, or you can say immunomodulator, thus regulating or reviving the immune system, reducing effects of genetic inheritance of disease, covers predisposition towards the ailment and hence prevention of disease, cements the weakness and the defects of the immune system, promotes buildup of immune blocks to fight back by invasion of microbes, helps in absorption of essential nutrients and facilitates expulsion of metabolic waste. Medicine acts as an antioxidant agent to neutralize the free radicals and to stop the process of deterioration of tissues. So, what is the role of homeopathy for skin? Homeopathy treatment have been very successful in treating skin problems. Conventional treatments usually end up making the skin very dry and irritable, but homeopathy has been proven to be safe and successful in treating a number of skin problems. Medicines improve immunity, thus they rectify the hypersensitive reaction. Intensity and severity of flare-ups is reduced. Childhood tendencies to skin issues are